Good afternoon. So we're gonna examine the patient's abdomen. So prior to the examination, we should do proper hand washing, and then we must we must make sure that prior to the actual examination, we must make sure that our stethoscope and our hands are warm. Okay, so ay sir, may hapon. Ako din sa intern lang sir, so mag-examine pa sa imong tiyan dapit sir ha. Okay ra nimo?
May hapon, okay ra pod.
Okay, so matudlo nimo sir asang sakit ron?
Wala ko gibatik karon man.
Okay, sige. So, alagad na tagigda sir, ato lang examine po. Para ma-sure na to. So have the patient lie down and then properly drape. And then have the patient lay supine, flat, and relaxed. So flex the hips and the knees slightly. And then the head relax on the pillow. So sir, palihog ko sa sir sa nina.
Sige.
So expose the abdomen from the nipple line down to the groin. Sige. So first you have to examine. So in the order of examination should be inspection, auscultation, percussion, then lastly palpation. So first you're going to inspect. So when we inspect the abdomen, we must do it tangentially. So as to observe for the contour, apart from the overall appearance, so look for scars, rashes, striae, and check for the umbilicus if ever there's any abnormalities which would otherwise suggest a ventral hernia. And then for the contour, check if it's scaphoid, flat, protuberant, or even globular. Right, so next we move on to the auscultation. So for the auscultation, again, make sure that the stethoscope is warm. So we can auscultate any part or any of the 4 quadrants for the peristaltic waves or for signs of peristalsis. So you can auscultate them as clicks. So the normal rate for this would be 5 to 34 clicks per minute. And then in the event of an obstruction, you can hear borborygmi, which is the gurgling sound of the bowels, which is a sign of hyperperistalsis. Then apart from auscultation of peristalsis, you can also auscultate for bruits along the arteries of the abdomen. So in the epigastric midline, you can listen for the aorta, abdominal aorta. Then lateral to it, left and right, are the renal arteries. Then right at the level of the umbilicus are the iliac arteries. Down at the groin area are the femoral arteries. So if you're suspecting hypertension with associated atherosclerotic plaques, atherosclerosis, then it is good to check for bruits along these areas or these arteries. Then we could also auscultate for friction rubs on the liver and on the spleen. So friction rubs may signify inflammation along these organs. So next, we do for the percussion. So first, using the pleximeter and the plexor, percuss for the 4 quadrants to survey. And make sure it's tympanitic. If there's any large area of dullness, then we consider masses. And then, for the liver span, we can percuss. The landmarks would be the nipple line and the umbilical line. Start from the area of tympani until we reach the lower dullness border of the liver. So down first, you have to do the midclavicular line, then next the external line. Then this is the part where it's dull. Then next, from the superior border, from the resonant to dull. So it's right here. Then using a measuring tape, measure for the liver span. So it's around 6. So the normal liver span for the midclavicular line is between 6 to 12. Now do the same for the external line. So it's between here. So the measurement should be between 4 to 8. 4 to 8 centimeters on the mid-sternal line. Any larger than those, any greater than 12 at the mid-clavicular line and 8 at the mid-sternal line would signify hepatomegaly. Then we could also percuss for the other structures or the other organs. So we could percuss for the spleen. So right at around the 6 intercostal space, here in the right lower costal margin, can percuss for the trough space and check if there's dullness. So the landmarks of this would be the mid-axillary line and the anterior axillary line. If there's dullness in between, then you should consider splenomegaly. And then, if at initial it is tympanitic, then you could check for the splenic percussion sign. So, again, percuss as normal. So, percuss over here. And then, instruct the patient to inhale. So, sir, palag ko ginamaster lang. Then, percuss again. If there's dullness, then we have to consider splenomegaly. Then another part would be the bladder. If the patient's bladder is distended, so at the offset of before you do the examination, make sure that the patient has voided. So if there's bladder distension, the lower abdomen should be dull. There should be dullness only if the volume in the urinary bladder is at about 400 to 600 ml. So this one's tympanitic. And then lastly, for the vertebral angle tenderness, so instruct the patient to sit. Sir, ano to sir? Yung sir? So locate for the vertebral angle. It's the junction between the 12th inferior of the 12th rib and the spine, the lateral border of the spine. So it's here. So place your hand over here, and then do the kidney punch sign. So percuss both sides. And then if there's tenderness, usually the patient will react to the pain. Okay, so that's it for the first 3 steps. Then next we go to the palpation.